Yo soy la que cuido y protejo.
The worries that a mother has, a mother without health insurance, they are so large. For undocumented people, the challenge is a lot bigger. And so I always have to be paying attention, making sure that I'm okay, that I'm healthy, so that my children can be okay also.
It's not uncommon that you'll see an undocumented parent or parents, and they'll have American-born children. An undocumented adult, they might have less opportunities to think about getting their healthcare coverage. The way that the Affordable Care Act is set up right now, they're actually not eligible to sign up for insurance under the marketplace, and so they may need to depend on other resources like public hospitals or federally qualified health centers or even emergency Medicaid.
No tuve seguro por aproximadamente.
I didn't have health insurance for approximately 3 years. The fear was that my information was going to be shared with immigration services. There have been times when people come to me so that I can offer them some guidance.
A lot of the times they'll go and they'll see a doctor that doesn't speak their language, that really does make it fearful for someone to go to the doctor because they don't really know if they're receiving the services that they should be receiving, or they're not really able to express to the doctor what their concerns are.
La incertidumbre.
The uncertainty. You know, wanting everything to be okay, but it's always gonna affect me. Emotionally, it affects me. Each day I'm thinking, I hope I'm okay, I hope I'm okay. But that's not fair.
4 years of my life was spent behind bars, Albion Correctional Facility. I've been home a year yesterday, and I'm grateful to say that. I have quite a few medical conditions. The one that I'm concerned about is my hepatitis C. I've had hep C for 20 years.
Sometimes it is really difficult for folks with complex health issues to stay on top of their health because of the cost. And that becomes a choice between, do I pay a bill, do I eat, or do I buy my medication?
I'm a diabetic, and being that I didn't have insurance, they billed me. So they want me to come out of my pocket with $360. I don't even have a subway card. Now, mind you, I was living in a halfway house. So that alone was an emotional impact.
It is very hard if you are homeless, if you are a substance user, if you are a victim of domestic violence, and all of the other populations that we deal with, for them to go to the doctor and be treated on the same level as other patients are. The best thing I can say is that sometimes we have to leave our personal opinions at the door.
Whatever normal is, I want to be a part of it. I want to pay my bills. I want to go to work on time. I want to swipe the Metro card. I want to know what that feels like to do every day instead of using drugs every day and going to prison, because that's what I know. So all those things I know, I turn it around. I'm around good people, positive people every day. I'm around powerful people, you know? And I too am powerful. And I want to tell people who I am.
That was a beautiful story. That was absolutely beautiful. Thank you so much for sharing that. I got a tissue. It's all right. It's all right.
The bill is passed.
Thanks to the Affordable Care Act, there's now millions of people who have health insurance. The problem is that having coverage is just not enough, and it's important, for people to understand what are the different options that are available to help them.
We don't understand the acronyms. What's a PCP? We don't know what that means. A co-payment. What does that mean? Access Health gives us, as an agency, the opportunity to explain that.
Access Health NYC creates resources and capacity to get the word out to their communities and is focused both on enrollment, but it's also focused on making sure people get information about New York's rich, robust network of providers.
Through community health advocates, we have a live answer toll-free helpline that helps people understand their insurance and troubleshoot any problems that they have with their insurance. And in some cases, we're able to offer legal representation, and through that, we're able to handle thousands of cases every year.
We hear a lot about how certain types of immigrants do not qualify for the marketplace. But what's interesting in New York is that in many ways we're much more progressive. We have a lot of programs, regardless of your immigration status, and I think that's where the confusion actually lies.
And so Access Health is really funding so that they can bring someone on who will go and do health fairs, go and talk to community groups, answer questions, and just do education in the community.
I got a bill for almost $5,000. I didn't know how to pay it, and that's why I hadn't gone to a doctor's appointment before. I came one day to Make the Road New York, and I was talking to a lady, and she told me that there was a promotora here that could help me to pay this bill.
Access Health NYC will increase our capacity to have the promotoras, which are peer community workers, conduct outreach and connect resources that our community currently needs.
In an environment like this, I think it's great for me and others to talk about their past, because we're more alike than unalike. We're the same.
I think that there should be more organizations like this. We are too many people, and each day there are more of us. My heart is very grateful for this organization.
I hope that Congress also realizes the great help that these centers offer us, because without health, we wouldn't be able to work. And if we are not able to work, then the country can never succeed or move forward.
This is what links people to all the services and programs that are available to them, and this is what's going to, in the end, help people stay healthier.
Access Health NYC is extremely important because it's given us the opportunity to ask people exactly what it is they need. No one has taken the time to do that before, and I think that there will be more utilization of health insurance as a direct result of it.